this first AI conference in ENT and to Dr. Kamalji to invite me here. I'm very honored to be here. And Dr. Manoj, thanks for the nice introduction. So in the next 25 minutes that are given to me, as you saw, I am a guy known for doing sleep surgeries in the country. But when I met Dr. Kamalji in IOHNS in Jammu, he said, why don't you talk on AI? I said, robotic is fine, is again not complete AI. He said, you're doing a lot of navigation in sinus surgery. Why don't you talk on that? So AI is actually when machine takes a decision instead of the human. Instead of human, when the machine takes a decision, that's the real AI. So is that happening in medicine today? I really don't think so. But the way Dr. Tushar explained things, we are just few years away. We are not even decades away from when machines will take decisions instead of humans. Whether that decision will be challengeable in the court or correct or not, these all questions will be unleashed over the next few years. But this is the basic difference when we talk of AI. And I really don't think AI has overtaken humans as of now in medicine. So in the execution part, in the decision-making part, yes, the diagnostic protocol, AI is already coming very, very, very fast. In the execution part, if you see assembly of a car, earlier there were humans which were putting in parts on the assembly line. It's completely automated by robots, right? So it's the execution, because here things are much simpler. Here 2 + 2 is equal to 4 in every single scenario. So it's much easier that put a robot, give it the dimension, it will do the job. But same is not the case when it comes to surgery, because the variables are too many, and therefore the experience, as we call it, the number of data samples that we have, analyzed in our lifetimes, and therefore the experienced surgeons. Now with 25 years, I can do better than what I could do at 5 to 10 years of my practice. So are we ready for handing over our decision making when it comes to an intricate subject like surgery to machines? So when I did the first robotic surgery for sleep apnea in this country in 2012, I was very, very happy that so ultimately it was me who doing the surgery. It was not the robot. Robot was only following my fingers. The bigger arms of the robots were only following my fingers. And if I did a mistake, the robot would also do a mistake. So again, this is not complete AI. So this is what is real AI. A robot performs first laparoscopic surgery without human help. And this is 2022. See, 10 years after I did the first robotic surgery for sleep apnea in our country. So obviously I was almost 7-8 years behind the world. Now in 22 January, the robot does the first laparoscopic surgery without human help. So this robot decides what to cut, where to cut, depending on the inputs it has been given to it. So the decision making is being done by the brain of the robot. Earlier, I was using only the hands of the robot. So this is the difference. We must understand that AI, we all seem AI is the holy grail. It's not. It's developing. It will take its own time. It will go through its own share of faults and misadventures and everything that we all have gone through. So sinus and snoring are very commonly related. So I obviously get a lot of sinus surgeries to do. And we all, as ENT surgeons, we all have our share of revision sinus surgeries. Now, this is obviously a case which was operated twice by my teachers and seniors. And in the sinus surgery, we see a lot of polyps, coming again and again. And we all want to see such a good result. So obviously, there's a different take to it, removing the middle turbinate, my theory of ethmoturbinectomy. I'm not going to that. But you can see the whole skull base and the orbit completely cleared. So we all want to see such kind of a result, but we are obviously unable to get it. Why? I joined ENT in 1999. So 25 years back, I joined ENT and spent a lot of time learning the anatomy of the sinuses. So lot number of CT scans and sessions and frontal recess this way, that way. Then your Kuhn cells, Agar-Nazi, type 1 cells, type 2 cells, 3, 4. We all go through all that supraorbital. I'll just not waste time on that, but we understand that these are innumerable classifications, innumerable type of learning we all undergo. And still, so anterior model artery, on the mesentery, on not the mesentery, on OD cell, this way, that way. Still, in practice, when you get a CT scan like this, a whiteout scan, क्या करने का? Oh God. Once you have a whiteout scan and you have to clear up the disease, which is actually not a medical, surgical, it's a medical disease. You are doing surgery for a medical disease and you have to go very close to the brain and the sinuses. And now in the CT scan, whatever you read, everything is looking Latin and Greek, and you're confused. And you know that when you go inside, you're bound to be flooded in blood. And then you are very near to the brain and the eye. So what do? You're fearing a complication. Then you go around, again, you attend conferences, again, attend workshops, and again, call up your seniors. And then what? By the time you become reasonably confident, you are this. And then it's time to retire. Am I right? Am I wrong? So I can see the youngsters. That's exactly what happens. Why? Because the area, the skull base is curved skull base. It's not a flat thing. And we are looking at especially the frontal recess area. I'm sure everybody is most scared and confused about the frontal recess. You are looking at the skull base. There's a cell below that. Is the frontal beak, which is the most constant landmark, but you do not know where you will get what, because you're having a tunnel vision. You're looking through a 2D endoscope, which will not give you a depth perception. And you're looking at the skull base. So which part of the skull base will come where, you do not know, whether it is here or here, right? That will make or break your surgery. So we must think out of the box. Now, I drove down from Bombay to Pune this morning and I had to reach AFMC. I have come here 3 times before, three times before, but still, obviously, I'll not remember the route. So what I did, navigation. Not only the correct path, but the fastest path, which side will get less traffic, which route it will tell me that. So I'll reach here in time, right? I'll reach here in time. So that is the whole thing. What is navigation? I'm sure everybody knows about it, but navigation will feed the CT scan findings into the system, and then you register the patient onto the software. Just fast forward so that when you register the patient with the CT scan of the same patient, then you make sure that the anatomy of this patient is coincided with all the parameters which are already recognized by the CT scan. And then there are instruments, the tip of which you can identify in all the 3 axes, real time, millimeter by millimeter, when you are performing the surgery, and you have a navigated debrider. The tip of the debrider is again, you can just see in all the 3 axes, millimeter by millimeter. So you know exactly where you are. The instruments, even if you're not seeing the tip of the instrument, the machine is telling where the tip of the instrument is, and you may not be allowed to do a mistake. Obviously, if you still want to do a mistake and injure somebody, you can still do it. But the machine will tell you that you are here and you should not do a mistake. Now, this is a frank polyposis. This is the tip of the debrider. And now this is a teacher standing not behind you, in front of you, and telling, okay, keep on debriding. You're far off. Let me go closer. So now you're so far, so when you go, you're 5 millimeter, 6 millimeter far. Then when you're in the frontal recess area, see exactly what you're doing. You're still few millimeters away. Okay, keep on going. It's amazing. It's amazing. It's nothing short of an artificial intelligence. Because with my natural intelligence, I'll take 30 years, 40 years to make that thing in my mind. where exactly I am. Will I do a, will I do a mistake? Will there be a complication? But this system tells me that, okay, you are still few millimeters away. Keep on doing. This is amazing. So I started doing navigation guided surgery around 9.5 years back. I bought my first Fusion. And now see this frontal recess area, a very interesting video. I'm just taking out I have already taken off the agar nazi and I'm just taking out the cells in the frontal recess area. And you can see this is the area which I'm working on. Now I am in the frontal recess area. I'm not in the frontal sinus. And I'm not able to see the tip of my scope because I have not taken off the, uh, you know, beak. I'm behind the beak. This is the sagittal. And now I'm operating without seeing the tip of my instrument. So endoscope is not working. It's only the navigation based on which I know I'm away from the skull base. I'm behind the beak. And I've already opened up everything. I mean, this was just amazing that frontal recess opened up without seeing. This is artificial intelligence. My eyes are not seeing what I'm doing. But in 3D, the software is telling me that you are here. Don't worry, go ahead. And your frontal is widely open. I'm just giving an example how, and then the cell behind the frontal, unless you remove all the cells behind the frontal, obviously your disease will come back. So you have to remove all these air cells. And then you want to know that, okay, I'm still away from the skull base. I will not hit the anterethmoidal artery, though I theoretically know anterethmoidal artery is one cell behind, but where is the artery? Should I remove this air cell? Will I hit the artery? Should I leave it? Then the system tells me, okay, you're pretty far off. Go ahead and remove it. And then you confidently can remove each and every partition, each and every air cell. This is intelligence. You call it natural, you call it artificial. Obviously, it's not mine, so it's the machine's intelligence. I'll call it artificial intelligence. You can call it artificial intelligence. Obviously, it is a simple thing. It's not as complicated as the real artificial intelligence, but it is still intelligence. So now whether it is a scan like this, a complete whiteout, or a scan which is a whiteout in making. Now this is again polyposis in an early stage. It's again ethmoidal sinusitis. You have to still do a complete job. So before navigation, would I remove each and every air cell here in this case? Possibly I would have left something here and there. There's not so much of disease. Let me just take it easily. With the navigation, will I leave this air cell? No, I will not. I'll still open it up. Because there's no harm in removing everything, because you know that this disease is going to come back today or tomorrow. If it is on left side today, if it is in the posterior ethmoid today, it will come in the anterior. If it is anterior, it will come in the posterior. So remove every air cell, remove each and every partition very close to the air cell. Well, do everything. It is again not my intelligence, it is the machine's intelligence. That makes me confident. So my decision making whether to remove this partition or not is actually based on the machine. If you have to open up the sphenoid and you're not sure whether there's a ONOD cell or not, should I go laterally or not? Now the machine is there to help you out. And obviously, middle turbinate removal or not removal is a question. I am a believer in that. But this is the kind of long-term results you can get. And this is only because of the machine. It's not because of the surgeon. And I'm sure if a 5-year experienced surgeon will do this work with the machine, he will be able to give the same result as a 25-year-old experienced. That is the whole difference, that you reduce the number of years. Because see, what I am able to do today after 25 years of expertise, if I was able to do when I was 5-year experienced, it would have been a great thing, because I would not have got my diabetes, blood pressure, hyperlipidemia. At that time I had more energy. So this is what a machine helps you to do, and these are the kind of results you get, right? So though it is not the real artificial intelligence, but this is where we have already reached. Where we have not reached, we'll discuss now. Right, this Again, you have navigated balloons. These are there for almost 5, 7, 10 years. So you can do a balloon sign